you a woman in medicine feeling overwhelmed and disconnected from the personal fulfillment that you desire? You're in the right place. Join Doctors Joanne and Aaron as they rewrite the rules for women in medicine. Let's begin.
Welcome back to another episode of Create Meaning in Medicine. Today, I'm so excited to introduce our listener to Dr. Rebecca Thompson. She is trained in both public health and family medicine and has a very unique story to tell, both through her experiences of her patients and colleagues on the path to parenthood and motherhood. And I'm so excited. She has, for those of you on YouTube, we have her book that just came out, Held Together. And I've been listening to it on Audible and have gotten through a big chunk of the book and so impressed. And I'm so glad that you are here with Joanne and I to help share more of that story and some tidbits that I think our listener can connect with, whether or not they are a parent. And so I would love to hear from you, Rebecca, on what inspired you to write Held Together.
Thank you so much for having me, to both of you. I really appreciate this opportunity. When I was first finishing up my public health residency and starting out as a new attending, I suddenly became a patient myself. I went through a string of pregnancy complications and losses, including 2 that were life-threatening to me. And during all of that, in spite of being a physician, I just felt really overwhelmed and really alone. It didn't seem like anyone around me was talking about these things. And as I talk about in the introduction to Held Together, what I longed for was a community of women. And I just couldn't find that. So essentially, that is what drove me to create this book. I wanted to create the resource that I hadn't had when I was going through that. And as I started to open up a little bit about what I'd been through, what my family was going through, my husband and I were going through as a team, I found that women, everyone all around me, so many people had stories that they were eager to share. And they hadn't found the space to do that before. And in talking with them and listening to their stories, I just knew that we needed to create something bigger out of our individual experiences and offer that back to others.
And I'm amazed at the number of women's stories that you have collected. Is it a total of 21 in addition to your own story?
That's right.
And I think about these complicated stories, and some of them are truly heartbreaking. And yet I think about, you were able to tease out these stories. You were able to open up enough so that these other women opened up to you, and you shared that some of them are your patients, your colleagues, friends of yours, and your own story, talking about really hard things. And I wonder, this idea of sharing not only your story, but these other women's stories, help me better understand why it was so important to include those along with your own.
Well, I think memoirs are really beautiful. They tend to capture one person's story. And when we read them, what can be so engaging about them is that we see ourselves, even though that individual story may be really different from what we've experienced, we can see the universal in the specific. I think that's why anecdotes in medicine are so interesting. The vignettes that we talk about with patient stories and how we teach sometimes, even with narrative medicine. But ultimately, I didn't want this just to be a memoir about my story only. I wanted to see the much bigger picture. And I didn't want it to be only about the early parts of family life, pregnancy, adoption, birth stories. I didn't want it to just have that focus. I wanted to capture complicated family stories through the long arc of parenthood. So inviting other women to join me to do this really allowed me to capture those perspectives and offer those as well. And I also didn't want it to be an anthology. I didn't want to just say to people, write down your story and pass it over to me and I'll throw it into a book. So the way that we put these stories together, I think, is really unusual. I haven't found anything else like it. I hope there are more. I'd love to hear about it because I want to read them all if there are. But for each story, that woman and I worked together. And over the course of several years, the whole project took just over 10 years. But for any given story, she and I collaborated for at least a couple of years, usually more. And they came together in different ways because of the different relationships I had with the people, of course. But for everybody, we recorded interviews, and then I would take that interview and transcribe it. So often this was, if she had been local to me, we might go on a walk or sit in a park or in a coffee shop and talk. If she isn't local, we would be on a phone call across time zones, middle of the night, maybe, depending if she's not even in the United States. Sometimes we'd have really awkward time zone connections. But I recorded everything. And then I tried to write the story in her voice. And some of these women love to write also, so she could give me pieces of journal writing or an essay that she'd written about a related topic, or even emails that she maybe sent to her family and friends during a challenging time to update them. Anything she could share with me, I tried to weave it together, and then I would give it back to her and say, okay, here, we shared Word documents. Here's what I've got. Could you help me understand this part better? What did I get wrong? Can we talk about this? Could you write maybe a paragraph or two about this idea? And just brought it all together and tried to give each story a real narrative arc and pull the reader in with the way that we told it, but using her words and her voice as much as possible.
Being somebody who's been working my way through the book, I do appreciate that you can tell the different personalities of the women, and you can tell that they seem to be written in the different voices. And it adds so much beauty to the story. And if you may not relate as much to one author or story, then you might relate more to the other. And so I loved how you weaved all of those different personalities and how they connected and interwove with your own story. I can imagine that it was a very complex, and yet I can tell very cared for project for you, taking over a decade. And what a beautiful testament to not only the stories, but also the way that you carefully put them together.
Thank you. I'm glad it came through.
Rebecca, thank you so much for being here. And just, I'm feeling so much just with all that you've shared so far. And we've often talked in this podcast how so many of us struggle in silence, how then in our own pain, then we find more loneliness, and the understanding of how community heals, and how beautiful that you've created community in your search and giving it the gift to other women, and like what a beautiful project. And then now you're sharing it through your book, and of course then interviews like this. So I'm very honored that you're here with us. And
thank you.
Yes. And talking about that, right? Like you shared some of these struggles openly. How would you say it changed the way you care about your patients?
Well, I hope that for me and for anyone who reads these stories, it helps us understand the context of the person better. Because we can say someone is a patient, but really everyone is just a person. And they come to us for a few minutes looking for help with something, or maybe hours or days if we're in the hospital, caring for them in the hospital. But it's such a small glimpse into their lives. And these kinds of stories really remind me who the people are, not just patients. That's something else I hope to inspire. And then, as you mentioned, Erin, a lot of these people were my colleagues or former patients. A lot of them are medical professionals themselves, about half of them. And that ranges from doctors to nurses to emergency medical technician and massage therapist, a psychologist. I tried to capture a wide range of kind of healing and service professions, not just doctors or nurses or one smaller group of those people. So I think this also shows us and reminds me, because a lot of my colleagues started coming to me for care as I went through my own struggles, and I think used that to inform how I took care of my patients. It drew in more medical professionals to come see me. Somehow that helped them realize, or somehow it drew that kind of work to me, which I love and appreciate so much. But it showed me also that physicians, nurses, therapists, none of us are immune to complex medical experiences. So to be able to care for them in those times of need, that's just been such a huge honor for me, and part of what I loved about not only this book, but the practice that I was cultivating during the time that I'm writing, taking care of them. Because it's not that we're unwilling to talk about our hard experiences necessarily. It's just the overwhelm. And Joanne, you talked on a recent episode about when you're so deep in the thick of your stress that you just can't even see your stress yourself. And I think that's a parallel to what we go through as medical professionals when we go through these kinds of health struggles.
Yeah, the tunnel vision, right? Like we zoom in instead of zooming out and looking at the bigger picture, where we don't minimize what's the struggle, we don't minimize the pain, but yet that's how we can think of what do I really need? What's the help? Who can I reach out? What are some other things going on?
Sometimes we can't even think of how to ask for it. We don't even know. We're out of touch with ourselves or our needs because we're so mired in the complications.
And that thought of, I talk about putting on the facade. I'm okay. Everything's fine. And as I read through some of these stories, and so many of them women physicians who are dealing with very stressful losses or very stressful in the thick of, they don't even know what's going to happen with their pregnancy, with their newborn child, because it's so complicated. And yet some of them hadn't even shared any of the information with family members, with colleagues, and they're just holding it all inside. And I just think, how much more difficult is it to hold that weight by yourself or with yourself and maybe your spouse or partner versus allowing enough vulnerability to be open and sharing. And for one woman, it was about sharing one pregnancy loss with her family and friends, and then being early in a pregnancy and sharing another pregnancy loss and another, and recognizing there's not one right way to do it. And yet my perspective is when we try to do it all alone, that seems like the most difficult when we carry that weight by ourselves instead of sharing that by being at least open. And then I also see where then you see that thread of, there are other people who've walked maybe not the same path, but similar, and how can they help bolster you as well?
Absolutely.
And so as a physician, Rebecca, how do you balance being the one who helps others with also needing to help yourself?
I think that's the question we all work through during our entire lives, right? This is the journey. We talk about in a lot of these stories how we can only heal ourselves by healing each other. And I think that the more that we get perspectives on others' stories, the more not only do we feel less alone, but we actually are less alone. We become part of these communities. We see our stories as, yes, still difficult, but not the only thing going on. We see the bigger world and the bigger human experience. And I think this just gives us so much perspective. It helps us grapple with needing help in a system where we are used to the ones being the helper, and drawing on that vulnerability really allows us to relinquish some of that control.
And as you're caring for your patients, when have you found it helpful to share your own experiences with your patients? Because that's not always, I mean, some people frown upon that. And where's that line for you?
I would say my first thought was maybe it's changed over the years, but I don't know if that's quite the right way to say. I think it's more that it changes by context. And so that's the context not only of any given patient's or family's experience, but also different settings that I'd be working in, right? So when I've been in kind of primary care clinics in the past, working with, say, women going through complications from pregnancy losses or fertility struggles, I wouldn't say that I share my story outright. I haven't in those settings, but it comes through without the words. When you read, okay, here's a little behind the scenes. in most of these stories, there are some Easter eggs. There are places where I am a character in the story. I am the friend that the person came to it for advice, or I'm the doctor using the Doppler to look for the heartbeat. But you don't know that. The reader wouldn't necessarily know that. You might realize it from something that happened in a different story and a connection that you make, but it's not obvious. And in Rachel's story, this is one of those examples where I am her doctor as she's going through all sorts of complications and navigating that. And she talks about when she first comes to the clinic that I'm working at, and I see her. Again, it doesn't show it that it's me, but I'm happy. She's happy to disclose that, as am I, in discussing it. She talks about how this is like the first time that the medical staff, the doctor, the people she's working with in this clinic, the dietitian, they get it. She feels seen. She understands her doctor, me, that like, I feel more invested in her situation than she's experienced, and she can't quite put her finger on it. And I think that's where it really comes through. We don't have to tell our patients, oh yeah, I did this or that. I've been through things like yours. They know when we've been through things that help us relate. And I think just being informed by our experiences and carrying those into the compassion that we show our patients, that's where it really matters.
Wow. Again, I'm like mesmerized here, just listening to you. And then also, trying to put myself in your shoes and in the shoes of this other women you shared their stories. And then also thinking of, right, like, how am I showing up for not just my patients, but my family and myself, and that compassion that's so important. And you're right, we don't always have to say, oh, I know exactly how you feel because it's not true, by the way. We don't know exactly how they feel. We might have had a very similar situation and have a very different experience, very different emotion. So how important it is that empathy to try to put ourselves in their situation, and how sometimes just the way we're even sitting in the office with the patient or with a friend that can show so much, and the importance. We all need that of feeling seen and understood, and kind of like how Erin was saying that how we're strong, we're independent, we're smart, and then we're just fine, and like we don't need help. And what a beautiful reminder that yes, and we have times when we're on the other side, and it doesn't need to be anything wrong going on to want that connection. And I love that that's how you started here in the podcast, talking about the connections and the community, because that's something that's very important for Erin and I in here. And I wanted to ask you about that too, of tell us more. You said some of it already, but how can sharing stories, because like Erin was saying, this is not something that we are used to doing. It's actually kind of discouraged in a way. And how can sharing these stories and building community then help the physicians and the patients feel that connection, and like you're saying, feeling less alone, seen, understood?
Well, I loved what you said, Joanne. I think this is part of the answer to that question about how you can't assume, even if someone has a very similar experience to yours, that what she takes from it is the same. And that's humility. And that's so key to the impact of these kinds of stories, is they help us have that humility in seeing others' perspectives. And in terms of how that ties into the patient experience, the physician experience, your last question, I think just this project itself, the ability to write down these stories, to talk with women, a bunch of whom were my own patients, it shows people that doctors are human too. Doctors need to stay humble. Doctors need to stay open to what these experiences mean. And so to have these stories in the world, showing the vulnerability and the questioning, the self-doubt of medical professionals, I think that benefits everybody, because it shows, we're all patients, right? I said I chose our patients. Everyone is a patient at some point. And if you aren't yet, then you will be. Your day will come. And so when we are patients, it shows us that our doctors are people, and our doctors are going through things that impact how they care for us, sometimes making it more resonant for them to care for us, sometimes making it challenging and putting up barriers. One thing that this kind of woven nature of the book allowed me to do was to show two sides of several of the stories, but one particular of the other physicians. And I won't give spoilers. And Erin, you haven't gotten to this part yet. You may have met Devora. She was my OB. And you see how she cares for me during all sorts of complications as she's just thoughtful, brilliant, but also compassionate doctor. That doesn't mean that she just believes everything I say or acquiesces to any request I have as her patient. She challenges me still, for sure, but she doesn't dismiss me like many other physicians had done for things that turned out were, misdiagnoses and such. But in the end, toward the end of the book, the last story that you read, aside from my own, is Devora's. And you see how she became that physician, what she's been through, what struggles she's had, what triumphs, what in-betweens, and how she became the person who was able to provide the care for me that she would have wanted for herself.
And this last two topics you've talked about in sharing story, and also your ability to take the difficulties as a physician, as a healthcare provider. I wrote the word lean in. So even without sharing your story, you had the ability to lean in to this patient, Rachel. And because you had, I'm going to put air quotes up, knowing. And that allowed you, as you said, without even sharing that you had struggles, to lean into her story, not to run away, which might be a typical provider who had not had experiences like yours, and to really be a different kind of provider, and to recognize this hardship I went through is making me just the right doctor for this patient and this other patient. And whether they know your story or not, that knowing and leaning in is so beautiful. And yet, one of the things I see so many women physicians struggling with is that lack of time. And I know that for myself, when I spent 10 years in child abuse medicine, our job was to dig into every corner of that Pandora's big, messy box, because if you miss something, it could be life-threatening for that child or adolescent in front of us. And yet, it was not helpful in my general pediatric practice, because when you overturn all the complex things, you're running behind, you don't have time to address it, it's impacting your workflow. And I just think of how much our time has shrunk, in addition to how complex and how much data we have to process these days in medicine, and how difficult that makes it to lean in even when you are that right doctor because of your experience and your knowing. How can we fight that trajectory in medicine so we can step into the doctor that we really want to be?
Yeah, and I think this is also about context, because it's true, we can't provide the 2 hours of letting someone's story unfold that we might love to have for every one of our patients. Absolutely. We can't do that in the setting of an acute care visit or, dealing with a focused issue necessarily. But maybe that's why it's so important to have these stories, these kinds of books, these kinds of conversations outside of the clinic, right? Because even if we don't have time to delve into everything in that setting, in that context, we carry these stories with us, whether as physicians or as just a reader of stories like these. And, I'll say to the lean in idea, I enjoyed taking care of a huge range of patients and different stories and situations in family medicine. As you can imagine, that's the whole lifespan. But I remember it's not just Rachel or patients going through things like what Rachel was going through that are grateful to find the setting like our clinic that was able to give her that kind of care. I remember vividly the first time meeting her. I remember what she describes in the story. And she told me all that by oral history, but as she's telling the story and I'm, recording it and then transcribing it, I had my own perspective on remembering it from the doctor's point of view. And it's a core memory for me from the time I worked at that particular clinic of how grateful I was that she was there, that I was going to get to try to help her with this thing that was the entire reason for why I went back and did a second residency. So I had done public health first, and then I went back and did a residency in family medicine to focus on women's and children's health as I was going through. Actually, at the time that you'll see in the book, as I started that second residency, I was just barely pregnant. I didn't even know it yet, with who turns out to be my son, my fourth pregnancy, the first one that worked out to be a child. And I had done that to meet people like Rachel. So to have her show up was, she was glad, but I was just as glad for different reasons.
Joanne, do you want to ask since we can do both questions, do you want to go ahead and ask the one about create meaning in medicine, and then it can toggle back to me?
Rebecca, thank you again. People ask me, like, how do you do what you do as a psychiatrist, like hearing stories, and it's beautiful to hear you talk about how it is a privilege to be on the other side, to have someone come in pain and in a vulnerable place, and to be the one who can help them, and that it's important for our sense of self and who we are, that we feel good by helping them, even when it's painful, even when it's a difficult situation, even when their pain reminds us of our pain. But like you said, then we can share it from a different perspective. And I always say, we don't have to have gone through the exact same thing our patients are going through, or our clients, to be able to help them, but it does give us a different perspective. Again, we don't assume, but I love how you said that doctors are people and what they go through impacts the way they show up. I'm paraphrasing. So it's really neat. And I love that we're so aligned, Erin and I, with your message. And the name of our podcast, it's Create Meaning in Medicine. And we like to ask that question, and I bet you have a beautiful answer of how you've created more meaning in medicine.
Oh, thank you. I've come to really feel that writing, collecting, listening to these kinds of stories has become my practice of medicine. And as I've shifted my focus from exclusively kind of primary care clinical medicine to be able to think about the ways that these stories can have an impact on larger populations of people using stories to heal, I just feel like with this book, we aimed to create a community. And I hope that we've done that. I think that we have done that. But even more importantly, we hope that our stories really inspire other women, other families, to feel like they are part of a larger experience too, a larger experience of humanity holding space for each other through difficult times. And we want to inspire them to seek out these kinds of relationships for themselves too. Because I think curiosity is what leads to this kind of compassion, and sharing stories can create meaning for doctors and patients and everybody in the conversation. And these conversations just have a much, much wider impact when we can all come together and lift up each other's voices.
So powerful. And I love that theme of community. And that to me means there's less being alone, which I see so much out there, and women just crying out in despair because they do feel so alone. And so appreciate you helping create that community for women going through tough times or struggles as they become parents. And the other half of our podcast name is Rewriting the Rules for Women Physicians. And how have you rewritten rules for yourself or other women?
Well, I think that the main way that I've aimed to do this with this book is that I say we're talking about uncomfortable topics, and this comforts us deeply. So redefining what is comfortable, what is appropriate, what is healing to talk about. And I will say I'm far from the only person doing this. I feel like we've had a lot more attention to these kinds of questions over recent years. I hope that will continue. There's really a movement toward being more open about these stories. It just wasn't there when I felt so alone back when we went through this about now, 17, 18 years ago. And the movement is building. And I just hope that more and more people, and especially women in medicine, will join this conversation.
Oh my goodness! Again, I know I'm a broken record, but love the messaging of the importance of community and how when we're in pain, I'll use y'all's words, like we lean in, not just for the other person, but for ourselves too, and the need to go opposite than what our brain does automatically, of like our brain kind of narrows into the pain, and how we need to really zoom out to reach out, because we heal in community, and the importance of stories and sharing, right? And it's a difficult thing in medicine because we're not supposed to, right? And I'm using air quotes again, and how you've taken this and created a movement. Really, I'm so impressed and proud of you. And like also the acknowledging that we go through difficult times, and that's part of our journey, and that yes, we're all patients in some way or another, and having the humility to be on both sides, and to understand, and the compassion for ourselves, and the compassion for our patients. And I love that what you said, curiosity creates compassion. Curiosity is one of my favorite words too. And I wanted to ask you, is there something that we haven't asked you that's important for us to know that you would like to share?
I just want to say thank you so much to both of you also for this opportunity, and for helping us all tap into our creativity to find more ways to enjoy being in medicine, but also just to support each other along the way.
Thank you. Perfect timing, as when this show airs, it's going to be Mental Health Awareness Month, and so many important topics for all of us. And with that, thank you so much for listening, and stay tuned because the next episode is coming right up.
Do you want exclusive resources and the opportunity to connect with us? Then visit createmeaninginmedicine.com now, where you'll dive deeper into how you can create meaning in medicine. And if you're serious about optimizing your results, take 2 quick steps now. Connect with us on the website and tune in to the next episode.